My name is Sarah Wilson, and I'm going to be talking about the benefits of breastfeeding related to women's health. Just an introduction to breastfeeding. Breastfeeding is a natural way for mothers to provide nutrients and nourishment for their babies. Breastfeeding provides benefits for both the mother and the child. Women have been nursing babies for as long as women have been having babies. Breastfeeding is beneficial for babies because breast milk enhances a baby's immune system and reduces the risk of developing diseases such as SIDS, obesity, coronary heart disease, and lymphoma. Breastfeeding also provides benefits for the mother, such as helping the uterus retract quickly after delivery and allowing her to have a quicker weight loss. Also, breastfeeding reduces the risk of nursing mom to develop breast cancer and osteoporosis later in life. Women's knowledge and practice of breastfeeding is often culturally and socially influenced. The practice of nursing differs greatly from culture to culture. Recently, a patient from South America noted that breastfeeding in her country is much more normalized. Women breastfeed openly and do not feel the need to cover their bodies or child as she is nursing. The patient noted her perception of breastfeeding as a natural and beautiful thing compared to many Americans who struggle and tend to feel ashamed as they're breastfeeding in public. Breastfeeding changed in America in the 19th century as cows' milk supply increased and became a substitute for breast milk. By the 1950s, artificial milk became popular and was associated with freedom from domestication, and many women tended to lean towards artificial milk versus breastfeeding. In the 1980s, various activist groups started to call awareness to the decline in breastfeeding and began to develop medical initiatives to help promote and educate women in breastfeeding. In the 1990s, UNICEF created the Baby Friendly Hospital Initiative, which I'll focus on later, which is a good example of one of these things that can help educate and encourage breastfeeding for women. The significance behind breastfeeding is that it's immensely beneficial to moms and babies. Human milk is not simply a food, but rather a complex human infant support system. That's a quote from Brenner, which I love because it encompasses the importance that breast milk can have for babies. Breastfeeding rates are lower in America compared to other countries due to the sociocultural understandings of breastfeeding. However, when various hospital initiation rates show that if there's direct education for women about the benefits of breastfeeding, then there tends to be an increase in the number of women who do choose to breastfeed. Um, However, less than half of the women who start breastfeeding at hospital are able to continue while they're through 6 months because they lack the support and necessary education to be able to be successful at breastfeeding. In the United States, breastfeeding rates are lower compared to other countries. Low breastfeeding rates, again, are related to inadequate support for mothers, and nursing can provide the education that moms need in order to succeed in breastfeeding their babies. Breastfeeding needs to be integrated and normalized into mainstream culture to encourage the growth and encourage the practice. According to Cochrane Reviews, the Baby Friendly Hospital Initiative data supports a link between education and successful breastfeeding. For instance, in 2001, 29 baby friendly hospitals increased breastfeeding by 32% compared to hospitals who did not focus on breastfeeding education. According to Healthy People 2020, the U.S. still continues to fall behind in the goals that they have set for breastfeeding. This is information that can be analyzed according to the breastfeeding report card. On this report card, they review 5 outcome indicators, 9 process indicators, and legislation and public action in regard to breastfeeding. The 5 outcome indicators include if the child has ever been breastfed, is breastfeeding at 6 months, is still breastfeeding at 12 months, has exclusively been breastfed at 3 months, or has exclusively been breastfed to 6 months. The 9 process indicators include an average score between the 5 outcome indicators, as well as the percent of live births occurring at a facility designated as a baby-friendly facility, the percent of breastfed infants receiving formula before 2 days of age, the number of international board certified lactation consultants per 1,000 live births, the number of La Leche groups per 1,000 live births, and the number of state health departments full-time equivalent dedicated to breastfeeding. State legislation about breastfeeding in public places, state legislation mandating employer lactation support, breastfeeding coalition with a public website. With all of these initiatives, there's a steady rise toward reaching goals that Healthy People 2020 have put out for breastfeeding. However, to this point, overall, the U.S. does fall short, so there's a lot of continued work to do to be able to reach these goals. Legislation and public action to support breastfeeding includes laws to protect women who desire to breastfeed in public without covering themselves, as well as mandating support for breastfeeding moms at work, including things like mandated break times to pump and a room dedicated to pumping. The etiology of breastfeeding is the mother's natural way to nourish her baby. Breastfeeding contributes again to the development of a child's immune system, and the human milk is the best source of nutrition for a developing infant. As already discussed, breastfeeding is a natural way to provide milk to an infant. Human milk aids in that healthy immune development, good digestion habits, including stimulation of positive bacteria in the intestines, and a reduce in the risk for significant diseases throughout life. Many issues do arise with breastfeeding. Some of those include inadequate milk supply, proper positioning, latching techniques, nursing in public, working and pumping, breastfeeding tools, health challenges. They can all complicate breastfeeding. So education, again, is key in being able to promote this. Milk supply can be an issue for women desiring to exclusively breastfeed and not being sure whether or not they should supplement with formula. Educating women regarding the nature of milk supply is crucial because the supply and demand relationship is key in keeping your milk supply high. The more a baby nurses, the more milk that the mother will have. Hence, frequent feedings every 2 to 3 hours is important in establishing that milk supply. Proper positioning and latching is a learned skill. Educating women on different positions, such as the cross cradle hold and football position, can help women allow the baby to properly latch. Latching problems can be aided with breastfeeding tools such as nipple shields, or simply learning to bring the baby to breast and not the breast to baby. Teaching mothers to watch for the suck, swallow, breathe reflex is also important in knowing when the baby has properly latched. There are also groups such as the La Leche League, which is a mother-to-mother support group that can assist in normalizing breastfeeding in public, educating moms about legislation in place to support them pumping at work, and connecting moms to necessary support systems when medical challenges associated with infant or mother complicate the breastfeeding relationship. Again, this is a global health concern. Breastfeeding is declining around the world. UNICEF is a group that is developing global strategies for infant and young child feeding. They develop action plans to help protect, promote, and support breastfeeding, support families through the healthcare system, and provide community initiatives ensuring that educated healthcare workers are prepared to support nursing moms that they encounter. Other groups besides UNICEF and the La Leche group include the International Baby Food Action Network, Baby Milk Action, Baby Feeding Group in the UK, Save the Children in the UK, World Alliance for Breastfeeding, UNICEF, WHO, Emergency Nutrition Network. These are all groups that call collective action to support nursing mothers and promote human milk as a relative superfood for the babies. One example, as I had mentioned earlier, is the Baby Friendly Hospital Initiative program, which focuses on educating healthcare workers to educate mothers about the importance of breastfeeding and supporting breastfeeding. Furthermore, this initiative is a 10-step process for successful breastfeeding. It includes written breastfeeding policy for the hospital, training the staff, educating pregnant women, initiating breastfeeding within half an hour of birth, educating how to maintain lactation, only offering breast milk to infants unless medically indicated, practice rooming in, encouraging breastfeeding on demand, not offering pacifiers to breastfeeding infants to limit nipple confusion, and fostering relationships with breastfeeding support groups on discharge. The target population, obviously, for this study is any mom who is expecting, prenatal expectant mothers, new moms in the hospital, or new moms who are under midwifery care, and also moms who have had a baby and are in that first year of life. Sometimes the nursing relationship does continue longer if it's desired by both mother and child. Early education can help expectant mothers to understand the importance of breastfeeding and prepare them for possible challenges that may occur with breastfeeding. Any new mom should be encouraged to breastfeed and provide significant education to show the benefits for both her and her child. Continued professional and communal support can help establish a long breastfeeding relationship between the mother and child. There are impacts from breastfeeding, and they're positive. Positive effects on the infant's immune system, positive effects for short-term and long-term for the mother, community support groups, normalization in society. supported by appropriate legislation. Again, as stated earlier in this presentation, there's no negative impact to breastfeeding. Human milk is a preferred form of nourishment for developing infants, which enhances a baby's immune system and provides benefits to the nursing mother. The positive impact for the mother includes the uterine reduction, enhanced weight loss, reduction in risk of developing breast cancer and osteoporosis. Community support groups such as the La Leche League exist to provide the mother-to-mother support, and they also lobby for appropriate legislation to protect and normalize public nursing. Public education can can normalize and encourage the breastfeeding further in society. Again, these are all positive changes. Strategies to help initiate these changes include educating the staff. Many professional nurses do not understand the benefits or the scientific research behind human milk for both mother and child. Education is empowerment. By educating staff on current research about human milk, as well as educating staff on the basics of breastfeeding, the staff can then in turn educate moms on how to best support their developing infants. Second is educating new mothers. The Baby Friendly Initiative is a 10-step process that allows staff to educate mothers on how, why, and when to nurse babies and give staff guidelines to facilitate the supporting mothers. Third, support on discharge. RNs need to be able to connect moms to support when they leave the hospital. These things can be groups such as the La Leche League and other communal activist groups who can help them as well. Fourth is legislation. Supporting legislative groups and lobbying activists can help provide continued support for breastfeeding globally. Fifth is public awareness. By normalizing breastfeeding and calling attention to the issue, more mothers will likely be comfortable in trying and continuing to nurse developing infants, which will in turn help the United States to reach Healthy People 2020 goals in relation to breastfeeding. As I've studied this area, I've had some great areas of learning. They revolve around breastfeeding initiatives, legislative action, and supportive options for breastfeeding mothers. Throughout my research for this presentation, I've learned about many breastfeeding initiatives, such as the Baby Friendly Hospital Initiative, La Leche support groups, and current legislative action to promote breastfeeding. I've learned about scientific research to show positive effects of breastfeeding for both the developing infant and the nursing mom. And I've also learned how I can be supportive and a means of connection for struggling moms who desire to breastfeed and are having current challenges with them. In conclusion, I think human milk is a great way to support infant development. Societal normalization of breastfeeding is key in educating and supporting women who desire to breastfeed, especially in the United States. Professional nurses have a large role to play in educating, supporting, connecting new moms to a positive support system so that they can encourage breastfeeding. Thank you for your time. Here are the references that I've used in studying about the breastfeeding information presented today.